All right, today I'm showing the artificial urinary sphincter for male stress urinary incontinence. This is the AMS 800, the only company that makes it. This is Boston Scientific. There's no real competitors on the market in the US. This is the one I'm going to show. I want the camera to focus here on the cuff. So this is the most important component. This is the part that's doing the actual work. This cuff will go around the urethra. And this cuff has a little bag here that is normally filled with fluid, salt water or saline, and that fluid is at a pressure that squeezes the urethra shut. So 99% of the time, the fluid is in this balloon. And it's by squeezing the pump that you move the fluid out of the balloon to loosen the cuff to allow you to urinate when you feel like you need to urinate. So right now, obviously, the cuff is in the open configuration, is in unlocked, not around the urethra. That's sort of how it comes out of the box. Now, the part of the surgery that we have to do is dissect around the urethra so that we can put this cuff around the urethra. So in this model, this clear bar here is meant to represent the urethra. And so I'll just show you what it looks like when the cuff is around the urethra. Okay, so I don't know if that's coming into resolution. The cuff is now locked around the urethra. You can see it kind of in a side or oblique view. And you can imagine with saline in there, that can squeeze the urethra shut pretty tightly, and that's what gets you to be dry. Now, this cuff is connected to the pump by this clear tubing you can see here. So the pump goes into the scrotum next to the testicles in a place that's easy for the patient to access. The pump has two components. There's the main component down here, which is basically the bottom half of the device that the patient squeezes to open the cuff. And there's this little nipple here at the top. This little nipple the patient never has to interact with. That's just for the urologist to turn the device on or off in certain situations. But normally with the patient walking around, the device is obviously on, and this nipple is not come into play. The patient doesn't have to touch this. The patient just squeezes on this pump here to move the fluid out of the cuff. Now, where does the fluid go when the fluid leaves the cuff? It goes into this tiny balloon. This is called the pressure regulating balloon, or PRB. It holds about 23 milliliters of saline, and this balloon goes underneath the abdominal muscles. So usually we make a second incision just above the pubic bone in the lower abdomen to open up the fascia in front of the abdominal muscles. We create a little pocket for this balloon, and we close the fascia above it, and we fill the balloon with 23 to 24 milliliters of saline, and we connect all of the tubing. And then 6 weeks later, we turn it on. And when you want to urinate, by squeezing the pump, you push the fluid from the cuff into the balloon. And the balloon is not entirely passive. The balloon is called a pressure regulating balloon because it naturally wants to go back to its sort of deflated state. So it wants to push the fluid back through the pump into the cuff. And the reason that's important is that the patient never has to push another button to close the cuff. The cuff closes on its own after about 2 minutes, and that's sort of the work of the balloon. The balloon is designed to push the fluid back through the pump and into the cuff after about 2 minutes. So what the patient does when their bladder feels full and they feel like they need to pee, they go to the bathroom, they squeeze the pump, pushing the fluid into the balloon, they pee, and then after about 2 minutes, the fluid makes its way back into the cuff and they're dry again. And that's basically how this device works. It's been on the market for over 50 years. Obviously, they've made improvements every few years. But this is the gold standard treatment for male stress urinary incontinence. And now you can see it up close, how the device actually looks and works.